Thank you again for showing up today. Much appreciated. Today's topic, I know that we've discussed this many a times. I've been here for 4 years now, and I've been talking about this left, right, and center. But today's going to be on outbreak management for community support services, primarily for ADP. So now, I know I did do a presentation back in August or July. It's been a while now on outbreak management. But one of the things whenever I discuss outbreak management, is I'm always talking about long-term care homes and retirement homes. This is always really geared to those areas because that's where we tend to see all of our outbreaks, and that's where public health tends to put a lot of their resources and a lot of their time is always put into long-term care homes. So I figured, let me go through this again. Let me figure out a way that I can put something together that is more generated for us in ADP or for community support services agencies. So a lot of the stuff that was in a lot of these outbreak management or initial outbreak management protocols, I've taken out and just kind of rejigged it so it more or less is more relevant for us in community support services. So as we go through this today, I'm just going to mention that the actual protocol and policy is pretty much completed. So what I'm going to do is share it with the rest of the group sometime next week, Monday or Tuesday, and it's going to be put into a checklist format. So whenever you run into a situation where you have a massive amount of new cases of be it respiratory illness, gastro, you have some form of a checklist that you can follow. So without further ado, let us begin. Next slide. So what I'm going to be talking today is what are the key differences between COVID, influenza, and RSV, which is just going to be a quick run through. We're going to talk a little bit of RSV, influenza, and COVID-19 in terms of the symptomology. We're going to talk about outbreak management, surveillance, and reporting, outbreak identification, outbreak and case definition. I'm going to talk about the outbreak response team and what occurs on that level, initial outbreak response and case management, contact tracing, infection prevention and control, and mandatory reporting. And then just a quick blurb on infection prevention, workers' health, and safety as well. Next page. Key differences. So I've been getting a lot of calls. I've been speaking to a lot of our team leaders regarding RSV, flu, and COVID-19. And some of the questions I've been getting is, hey, Dale, I really have to do a rapid antigen test to be able to differentiate between the differences between RSV, flu, and COVID-19. And I said, yes. If you're just going to primarily do this based off of symptomology, it's going to be near impossible because all three pretty much have the same or similar infection or period of incubations, period of communicability, and probably last in terms of duration about roughly the same time. So there's always been some differences in talks about how do I know in terms of symptomology? And I'm like, you'll never know, but here's just a brief explanation. So with RSV, we tend not to get sore throat. RSV tends to affect a lot of young children. That is primarily the group that gets affected, and mature adults or adults in your senior years. And a lot of it is because of their immune response. Immune response isn't the best. As we get older, we know our immune system tends to break down. We become prone to other infections. We get prone to other diseases. And as well as when we're young, our immune system's just developing. So we tend to pick up a lot of infections, a lot of different viruses and bacteria. So with RSV, it tends to be very prevalent in young children or in adults or mature adults, 65 years, 60 years of age and greater. Some symptomology for RSV, again, not again, but as I go through this, is typically your cough, your sneezing. Sometimes you may get a fever. Sometimes you may get body ache, and sometimes you may get tiredness and headaches, but you'll get a runny nose, stuffy nose, and in some cases, a little bit of shortness of breath. Loss of taste and appetite is definitely not associated with RSV at all. Now, with flu, I like to call it influenza A, influenza B. I tend to see a lot of sore throats, coughs, and sometimes you get sneezing. But one of the very common symptoms for flu, influenza A or B, is your fever and body aches. Those are still synonymous with influenza A and influenza B, or the flu is that fever and those severe body aches and cramps. You will get tiredness, you will get a bit of a headache, and you may also get some shortness of breath or runny nose. But what you're going to know and what you're going to realize is that whenever we're dealing with someone with the flu, they're going to complain about having a very high fever, which is anywhere between, well, abnormal fever is 37 degrees Celsius and above. A fever is 38, but they tend to be a little bit higher, 39, even 40 degrees Celsius or more. And they're always going to be complaining about body aches. That body ache component is very important because they tend to have a lot of body aches when you do have the flu. COVID-19, I know we've been COVID-19 out, and we probably can do this, say this, or teach this ourselves as well. But some of the common symptoms with COVID are going to be your sore throat, your cough, your fever for sure. Because a lot of times, that's what we ask you. You ask that your fever diminishes before you return back to work, 24 hours. Body aches, sometimes, sometimes tiredness, headaches. And as well, one of the most common symptoms, and as much as it says sometimes, this is more of a common symptom with COVID, is your loss of taste and your loss of smell. Next page. So symptoms unique to RSV are going to be, again, as I said, typically it's going to be kids of age 2 or adults or older adults, 65 or 60 years of age and older. Transmission with this is typically person to person via contact or air droplets. So just like influenza, just like COVID, you can get RSV as well. So droplet and contact precautions. Most people recover from RSV on their own at home, but sometimes it can lead to severe illnesses such as bronchitis, pneumonia, and some other complications as well. So RSV, a little bit less of a lesser organism in terms of severity, but it can be very dangerous in those who are very old or those who are very young as well. Next page. The flu. This is one that has been killed over the many decades. So we know a lot about flu. We know that the flu tends to get a very high fever, as I stated already, along with other respiratory symptoms. And as I said already, 39 to 40 degrees Celsius is usually an indication that, hey, you know what? Maybe not RSV, maybe not RSV, maybe not COVID, but definitely is the flu. A person may experience symptoms anywhere from 1 to 4 days after infection. So we have a period of incubation with many of these diseases. And as I said, the reason why I wanted to show you RSV, flu, and COVID is very similar. The period of incubation is roughly similar. Period of communicability is also just as long or very similar between the three as well. So with this organism, we're saying 1 to 4 days after infection is when you're going to start showing symptoms as well. They can spread from person to person between people who are near or in close contact with one another. And people usually feel miserable. You know when someone's feeling miserable, severe body aches, severe fever, and in some cases, even vomiting, it tends to be the flu. Children under the ages of 5 and especially under age 2 are at a high risk of complications from the flu. These may include dehydration, inflammation of the heart, brain or muscle tissue, pneumonia, sinusitis, and even ear infections as well. Next page. And when we're talking about COVID, again, as I said, we are so COVIDed out. I'm sure everyone could teach this and better than I can because we've been talking about this for the last 4 years. But the signs of COVID are similar to flu and RSV, but unlike the other viruses, COVID can have a serious effect on the body systems, including the lungs or outside of the lungs. Spread person to person as well between people, or even via fomites and inanimate surfaces. So just like with flu, just like with RSV, it's through droplets or even contact as well with that person who's infected. So if I have it, I'm hugging you, I kiss you, or I sneeze on a surface. You touch that surface, wipe your nose. I like to call it the T-zone, your nose, your mouth, your eyes. You stand the risk of getting it. And one of the biggest changes or differences between COVID, this is not similarities, they're differences, is that it's a super spreader. There is there is something that we call, I can't remember off the top of my head as I go a little brain dead right now, but it disseminates how many people this organism can infect. And what tends to happen, as you will notice, and it's been talked to many a times, one person can infect 20 to 30 people very easily with COVID. Whereas with flu, we're taking about 3 people. RSV, it's about the same thing. 1 to 2 people can be infected. So it's not as super spreading as COVID. Droplet contact precautions. COVID can cause long-lasting or long-term effects such as brain fog and other issues. And typically, a person may experience these symptoms anywhere from 2 to 5 days or up to 14 days after infection as well. So that's one of the reasons why, if you are positive for COVID, we ask that once you're feeling better and the fever has been subsided for 24 hours, no other symptoms or symptoms are starting to disseminate or dissolve, you can return to work, but we ask that you wear a mask, a medical mask, for another 5 days because as much as the risk is low now because the fever is gone, symptoms are gone, there's still a slight chance that you can transmit or infect other people as well. Loss of, oh, sorry, next page. Oh, sorry, my bad. Loss of appetite and vomiting and diarrhea. Up to 30% of children do get vomiting and diarrhea. Next page, please. So now we're going to get into outbreak management and what we are expected to see in our field. Now, again, as I stated, I did a piece on outbreak management a few months ago. It was more dedicated to long-term care homes and retirement homes, assisted living, congregate living settings, and that was based on what's out there. So now what I've done is I've kind of condensed everything with a little bit of an explanation. And what I will do again, and I'll probably going to mention this later, a little bit later on again, many a times in this presentation, I will be sending you guys out a checklist format, something that you can use for the ADPs or for community support services in an event that you run into a situation where, hey, Dale, we have an outbreak. Something's going on. I have X amount of staff that are calling in sick. I have X amount of clients that are calling in sick. What's my process and what do I do? So first thing that we have to do in terms of surveillance and reporting is have early recognition and reporting of an unusual cluster of gastrointestinal or respiratory illness in or within an organization or within any given area. So if you say, hey, I am seeing about 6 or 7 of my staff members call in with respiratory illnesses. I've seen those same staff members who are sick, who were in contact with a certain amount of clients or a specific amount of clients who are also now sick as well. There's something brewing in my facility. So there has to be a way of us being able to recognize that. And a lot of that is going to be just your basic reporting and screening in the morning. So first step is community areas are strongly encouraged to foster and enhance existing partnerships to include infection prevention and control measures and education on early recognition and reporting of illness so that a timely and coordinated response can occur. So it's going to be between ourselves as we build our strong partnerships between each other that we figure out how is it that we're going to recognize this. This is either going to be through, again, as I said, through screening or through just even basic sharing information. I've been in outbreaks where I had one facility in outbreak, and the other facility calls and says, I think we may be going through outbreak. And I'm like, why? Because that other facility that's an outbreak that's on that list, or that other facility in that area is an outbreak, a lot of their staff members work here, and I noticed that some of our staff members are calling in ill. So that sharing of information sometimes can help respond to the outbreak much quicker. It is also strongly recommended that each community area keep current a directory of all staff and clients as well. And this information will facilitate early planning and communications with public health if required. So I know already as it is that I'm pretty much sure all the health units that I've dealt with don't really respond to us. Well, whenever we running into a situation where we have an outbreak in maybe an ADP program, an out of day program. However, us calling them kind of gives them an indication that something is growing on. And in a lot of cases, they will send you information to help you disseminate to your clients or to the stakeholders to help things help things move a lot easily, a lot efficiently, a lot effectively. That's perfectly fine. But a lot of times they're not going to do anything. So it's just up to us to work amongst ourselves to figure out what we need and how we're going to handle this together. Next page, please. Outbreak identification and line lists. So outbreak definitions. There's always an outbreak definition that we have, and there's a general definition that's just recently has also been changed. And the reason why it's been changed is during outbreak season over the last couple of years or few years, we've had outbreaks that have been called because of staff members. And to call an outbreak in a facility or in a organization because of staff members does not make sense because a lot of times these staff members, just like even our clients, are picking up things outside. So a lot of our case definitions are based on just our clients, or in cases, because this is really relevant for a lot of long-term cares or retirement homes with their residents or patients. So a typical outbreak case definition would be confirmed respiratory infection. Outbreak definition would be 2 or more patients, residents cases of tests who have tested confirmed acute respiratory infections with symptoms onset within 48 hours and epidemiologically linked to or suggestive of transmission within the setting. So it's one of those where, okay, we had two or more people who are ill within those 48 hours. They're all epidemiologically linked. So when I say epidemiologically linked is that one ill person was in contact with someone else who's also confirmed to be ill, who's also in contact with somebody else who's also confirmed to be ill. So there's some form of epidemiologically linked issue going on here. Or 3 or more patients resident cases of ARIs, which is acute respiratory illness, with symptoms onset within 48 hours and epidemiologically linked suggestion of transmission within the setting, and testing is not available or all negative. So, hey, you know what? I have some people who are ill, they're sick, there's a respiratory illness. I've tested for COVID, it's negative, but something's going on. So in cases like that, we'd ask them, hey, you know what? We're going to isolate you. We don't want you back here until you're feeling better, but I would suggest that you go to your GP, go to your hospital, go to your general practitioner, and get tested for maybe influenza, COVID, or RSV as well. In a lot of cases, a lot of people say, is there a real reason for that? A lot of it is just to ensure we understand what they have, because at the end of the day, and I'll say this again later on, we handle RSV, influenza, and COVID all alike in terms of when it's time to return back to work and in terms of our isolation criteria as well. And then a suspect respiratory infection outbreak is two patients or residents' cases of ARRs with symptoms onset within that 48 hours period with an epidemiologically linked, same unit floor, service area, suggestive of transmission and the setting, in the setting, and testing is not available or all negative as well. And that's what we consider a suspect respiratory infection outbreak. Next page. So again, in terms of case definitions, and a lot of it at the beginning, you're going to say, hey, okay, we got something brewing here, Dale. We got a lot of people that are ill. We've tested, some have come back positive for influenza, maybe COVID. What do we use as a case definition? Because just because you got a runny nose doesn't mean I'm going to isolate you from work. You know, a runny nose could be like right now I have a little bit of runny nose because I'm outside and it's cold outside, change of weather. I might have a runny nose because of allergies. So we need to find out, does this person really, really, really identify as a case? Is this person really sick? Do I have to worry about this client or this patient or this staff member? Because they do have a symptom, but maybe it's nothing. So purpose of case definition is to ensure that cases are counted in a systemic and consistent manner to enable comparison analysis of trends. So it's a way of us saying, okay, something's going on. We got a line list brewing. We got a few people that are ill. We got a line list that's set out. And now we need to make sure these people make case definition. When we put these things on line lists and we are able to formulate what's happening, it's an easier way of us understanding and having a better picture, a better big picture, a better big picture of what's occurring in our facility or in our organization as well. In an outbreak investigation, case definitions are used for counting outbreak cases only. They are not used for establishing clinical diagnosis or making healthcare decisions for any individual patient, which we know. And a bill of case definition for an outbreak is often helpful to consider what is known about the outbreak. So the disease, the pathogen, the descriptive epidemiology of the ill persons, and how ill persons are likely to be identified as well. So testing practices, surveillance systems. Now, with us, in terms of testing practices, we don't get into that too often. We don't get into that at all. That's more or less for the client or the staff member to do after the fact. When we know something's going on and we really want to understand whether or not they're truly a positive person for influenza, RSV, or COVID as well. The next page. Outbreak identification and line lists. So I'm just going to go through this fairly quickly. I've talked about this at the last outbreak management session, and I think we all know how to fill out a line list. It's very easy, very self-explanatory. But I like to go over this because this is a very important step. Seems very, very easy, it's just a line list. But this in itself helps us to put together, and I've said it before, something called an epi curve. So if public health does get involved, or maybe if we have someone within an organization who's a really good IPAC person. When I say really good, I mean they're like, hey, let's formulate an epi curve to really get a full understanding of what's happening here. That line list has to be built properly. So it's the table that contains important information about each case in the outbreak. Each row represents a case. Each column represents a key variable such as name, date of birth, et cetera, resolve dates. Line lists help to keep track of each case during an outbreak as well. So it tells me whether or not this person's been vaccinated. It tells me the person's date of birth and their age. It tells me where they're located, which is a big one. If you're working in a long-term care home or any type of residence, that's a big one. But with us in ADPs, we just need to find out their name, the date of birth, their symptomology, whether or not they've been vaccinated. You don't have to really tell us that. It can be confidential, but it's great to know that. And whether or not they were resolved. So start of onset of symptoms and when they resolved as well. So it kind of gives us the understanding that this person can come back. They've been resolved, no more symptoms. This person should be staying because I see here that their onset date started on this date, and we need a few more days before we can allow them to come back. So it helps us to understand what's happening and helps us to organize who's ill, who can return, and what needs to get done with this person as well. Helps attract sick staff as well, clients or residents, which enables us to implement and control outbreaks effectively and efficiently. And it also helps to formulate an epi curve, which I already mentioned as well. Next page. And again, just a quick example. I'm going to be very quick with this. I've shown it before in the past. I love this. It's something I did back in Toronto Public Health decades ago when I was working there, as I age myself. And I know Durham used the exact same line list that we used and took it, and it works well for everybody. But this is a line list that we use, one for staff, one for residents or clients. And again, we're in ADPs, community support services agencies. A lot of stuff here you might not fill out, like in terms of whether or not they get X-rayed or whether or not they got MP swab. Our biggest reason is just to be able to capture who's ill, day it started, and when they can return, or whether or not it's resolved as well. Next page. Case management and contact tracing. Now, part of this as well, and I'm not going to get into this too much because a lot of this case management and contract tracing aspects, yes, we do it on our end, but a lot of times public health are the ones that have to do this. But I know that public health does not respond to us whenever we have any questions or whenever we run into a situation where we know for sure it's an outbreak. But it's still good to know because it's good for us to be able to do it as well. So case management is to investigate and confirm if a workplace is truly an outbreak or whether or not an outbreak truly exists. It investigates and manages all cases of reportable diseases according to public health or local public health. So it helps you to figure out who am I going to isolate, whether or not they've been tested. Also captures the other personal information. It identifies any close contacts as well, whether or not I need to isolate them. So push come to shove, if we're doing with something else that isn't COVID, that isn't influenza or isn't RSV, but some other organism or disease, we know that if this person was close to our confirmed case, maybe they need to get isolated. So that's what case management does and contact tracing helps out with as well. It prioritizes testing of any symptomatic individuals associated with the workplace and any symptomatic close contacts of an individual associated with the workplace as well. And then testing is also recommended for all asymptomatic individuals who are close contacts of confirmed cases. So typically what we usually do whenever we're dealing with this, because now things have changed because we don't really follow contacts of a contact of a contact. But if we know that someone was around someone within our organization who has tested positive for either COVID, RSV, or influenza, and we know that, now that masking mandates have all been revoked, no one's wearing a mask, there's a very strong likelihood that they could have been infected or transmission could have occurred then as well. So that's why we asked that, hey, you know what? Let's contact this person. Hey, Mr. Smith, you were sitting across from Mrs. whoever, Mrs. Smith, and she was confirmed to have COVID. I suggest that you keep an eye on your symptoms or just keep an eye on yourself. And any time that you have any form of respiratory illness or distress, we ask that you one or two things do not come in if you are sick or if you have a fever, but go get yourself checked out by your GP to confirm that you're fine. But this is what's been going on. But in many cases, we're not going to tell them the name of that person that was across from you. You're in the vicinity of someone who was tested positive for COVID or influenza, and there is a slight likelihood that you may have been infected as well. Please keep an eye on yourself. And if you do get ill, don't come in, get tested, and we'll go from there. So case management helps us with all of that as well. Next page, please. Contact tracing. So again, as I said, contact tracing is when we determine or identify close contacts. So Mr. Smith, Mrs. Smith across from you, you're a close contact because you were in a close vicinity, or maybe you live in the same house. This is what contact tracing does. It helps us to identify those people who were in close proximity to that person during the period of communicability. So local public health units will help individuals with a reportable disease to identify this. However, we know we're not going to get that help, so we're going to do it ourselves. And close contacts or high-risk contacts include staff, visitors, or patrons who are within specific distance of an ill person for a specific duration of time, dependent on the reportable disease and how it is communicable, be it airborne, contact, or droplet. So if I'm in a room, which I've done many a times, where someone, for instance, let's use measles, is positive for measles, the case was in the room, and then two or three other people came in the room maybe 5 minutes after that case left. Those three or four people are now close contacts of that person because measles is airborne and very highly infectious as well. Next page. Outbreak response team. So we've formulated that we have possibly an outbreak on the go. We do know we have an outbreak. We've put together a line list. We know exactly who's on the line list. We're now communicating to staff and to clients what's happening and what's going on. We now have to formulate something called a outbreak response team. And what that is, we call it here in Toronto, in the GTA outbreak management team. So it's a coordinated approach to outbreak management, which is essential to outbreak prevention, control, and education. What this is a team that consists of everybody. So management, someone from management, somebody from dietary, someone from housekeeping, someone from floor, so PSWs, or maybe even RN, or maybe our client, our staff members within our facility as well. And they come together to figure, okay, is everything set up properly? Do we have a case? Do we have an outbreak? Who's on the line list? Is these people truly should be on the line list? Who's been sent home? Who's going to be home? This is what the outbreak response team does. It's vital that everyone involved has a clear understanding of their respective roles during this outbreak, and it's very, very important that we work collaboratively as well. And members of the outbreak team may be internal or external, as I said, could be anybody. EGs, could be your manager, it could be housekeeping, medical staff, dietary, anybody who has a stake in the outbreak in the facility. And it helps us to implement control measures easily as well, because if you have a specific area that you're not in charge of, that person who works in that area can help to implement the control measure in that area as well. Next page. Communication. This is the big one. So we have an outbreak and it's on the go. We have to communicate this to everyone around us. So that's communication to our staff. That's communications to maybe our partners. So we have people from long-term care homes coming here to our facility for programs. We got to communicate to them that something's brewing. And more than likely, if we have something that's brewing within our ADPs or within our services, more likely it's happening out there too as well. So they're going to call and say, yeah, we realize so and so's sick, and there's been a few other people that are sick as well in our facility here. So yeah, something is brewing. And it helps us to communicate that to them. It helps us to communicate to the clients themselves as well, and the caregivers. Hey, you know what, guys? Today's program is going to be closed because we had 6 or 7 clients report illness, and maybe 6 or 7 of them have tested positive for COVID. We need time to clean up, get things put back together, give time for them to recoup before we bring everyone back together in the ADP. So this is what communication is for. It helps things to run smoothly, it helps to alert everybody, and it helps to communicate what's happening within the organization to those that need to hear. So all of our important stakeholders as well. So the executive director of these agencies will be responsible for communication with clients, visitors, and staff. Material for public dissemination will be reviewed by public health. So if you have anything that you want to take out, it doesn't have to be reviewed by public health. It can be reviewed by us. But again, communication helps us to allow those around us who are using our services understand that something's going on. So a lot of times, if you do have an outbreak, we'll probably send out a notice in the mail or even a phone call. Hey, something's going on. Or hey, we had 5 people test positive for COVID. This is what COVID is. This is where we found it. This is what we're expecting people, or when we expect people to return. It kind of outlines information that's needed to handle the outbreak. Because the last thing you want is to have people who are sick coming back into the facility, and just it becomes a big mess. So communication is a big thing. In the event of an outbreak that needs to be escalated, the outbreak is in multiple sites, is impacting staff as well as clients with increasing prevalence. Public health should be notified again. So if we run a situation, well, hey, Dale, you know what, man, Dale, I called public health already. They said they didn't want to know anything. But you know what? Things are getting a little out of hand. I now have, instead of 5, I got 15 or 20 of my staff members. I can't operate anymore. And pretty much all of my clients now are really ill. We had 5 or 6 of them that are in hospital. Cases like that, I would call public health again and say, public health, you know what? I know that you guys really don't, that's not that you don't care, but you don't have the power for this. However, I need to notify you that something is going on, and I may need more information to communicate out to the families, or I need more information to communicate to my staff as well. What should I do? So communication is a very strong thing. And in every outbreak response team, there needs to be one focal person that's in charge of all this communication. So if there's any calls that are coming in, all the calls are going to this person here who's handling the outbreak, because they can answer any question. They know exactly what's happening. And it's just kind of alleviates that whole realm of miscommunication or misinformation as well. So it's a very big one. Next page. Outbreak control strategy. So this is the most important part of the outbreak. So we're in the outbreak. We have everything under control. We know who's sick. We know who we're sending home, who's been isolated. We know roughly when they can return. We know we have an outbreak. We've communicated this. We've also, in terms of communication, I should mention, we've also posted maybe signs on the doors. So in case anyone does show up, they know that we're an outbreak. We've done our piece. Now we got to make sure some of these control measures are in place to stop the spread and to get everyone back into the facility. So infection control measures are crucial or critical to minimize transmission. Measures taken the least restrictive and take into consideration the potential impact on the well-being of clients. So a lot of times I'm one of those people, I'm going to kind of get out of the realm of ADP, but I'm one of those investigators or IPAC, whatever it is, whatever hat I'm wearing. I don't like to keep people isolated in a room for too long. So a lot of times you also have to think about the well-being of that person. Is it a great idea that I shove them in an isolation room right now until a caregiver comes? They have mental issues or dementia. They may become overly aggressive. Where do I put them? That is a conversation that you would have with the outbreak response team as well. Understanding that these control measures that we're implementing, as much as they're very important and they're a requirement and a must or heavily recommended, we're still trying to maintain the well-being of those that we provide healthcare services to as well. So examples of control measures are restricting symptomatic clients and staff to an isolation room until family or caregivers can pick them up. So we have a client who's all of a sudden coughing, sneezing, and has a fever, and we're like, something's going on. We're going to isolate them as soon as possible away from those who are feeling well, who are asymptomatic. Now we're going to put them in somewhere that maybe an isolation room, somewhere where we consider them away from everybody else, where they can't pass on or spread the infection until their caregiver comes or until a person responsible for them comes to pick them up. We're going to cancel group activities and social gatherings. So if I know that my group here goes to visit maybe another group, we're going to cancel that. We're going to either cancel it or we're going to prevent those people, those persons who are ill from joining in, because now we're going to end up causing an event for super spreading. And that's if we're dealing with COVID, even influenza and RSV as well. So canceling group activities and social gatherings. We're going to limit the people that are coming in. So we have a few cases of COVID in our facility or influenza. Things are getting a bit out of hand. We're going to hold off on new admissions. And I should say new admissions, sorry for the wrong choice of words, but new clients from coming in, and that it now puts in more people at risk. We're trying to reduce the risk, not increase the risk. So we're going to limit new admissions or new clients coming into the programs until we get everything assessed and the numbers come down as well. Visible and accessible education material and signage posted in visible areas outlining important information about the outbreak. So top of all those control measures, we're also going to, again, as I mentioned, communicate to everybody who's coming in and around our event or in and around our area that, hey, something's brewing, something's going on, there's an outbreak, or there's an increased number of respiratory illness. Buyer beware, or beware, do not come in here right now. We're going to enhance environmental cleaning and disinfection. That's the biggest one. Again, you probably heard me discuss this on many tables before in the past. I also consult for a large environmental services company in Toronto. And I always tell the staff, you guys are probably one of the most important components in outbreak management. And the reason for that is, yeah, we know hand washing is the single most effective way to prevent the spread of infectious disease or transmission of infectious diseases. However, cleaning as well is a big one too as well. If you clean and disinfect the areas very well, that means you're killing the organism. That means you're killing the bacteria, whatever it is that's causing the outbreak. Because we know that with RSV, COVID, and influenza A and B, flu, they're also transmissible via inanimate surfaces as well. So if someone was sneezing or didn't wash their hands properly, rubbing their nose, I've seen people reuse handkerchiefs and tissue paper. So we know that the virus is all over their hand now and they're touching things. It's spreading. But if you clean your facility or agency very well, clean and disinfect, you'll notice that there will be a demise or a slightly reduction in the amount of new cases as well. So that's a very important component there is ensuring that the air is clean and frequently clean and disinfected regularly, and especially in the high touch areas and high touch services as well. Next page. Another one, ensuring that everyone is performing proper hand hygiene, ensuring that staff are properly washing or putting alcohol-based hand rub sanitizer on the hand is a big one as well. And even masking. I know it's not here as yet, but masking is a big one as well. Ensuring that, hey, you know what, something's going on in the facility. We're going to keep our doors open. But you know what? To minimize that risk, I'm going to start now offering our staff and our residents masks to be worn when inside here until we're able to get everything under control and until the numbers start to demise or start to diminish again. That's another big one. Ensuring staff education and training with respect to 4 moments for hand hygiene. So understand the 4 moments. So we want to ensure that before they enter and leave the environment of clients and staff, they're washing their hands. If they're performing any form of aseptic technique or providing any supports to their clients, they're also washing their hands as well before and after. And by doing those little, easy little steps, you will notice a change in the amount of cases that you have if it is truly an outbreak. The accessibility of alcohol-based hand rub sanitizers are a big one as well. So you want to ensure that we have a way for them to sanitize their hands. And we sanitize our hands with ABHRs whenever our hands aren't visibly soiled. So if my hands aren't visibly soiled, I'm killing it. I'm using that all the time. If my hands are visibly soiled, I'm heading to that washroom, water and soap, and making sure my hands are washed properly. And again, this is all to diminish the spread of the infectious disease as well. And then planning for staff shortages is a big one, ensuring that there's a plan that's in place for surge planning, something that we are working on, and something that I've sent a few questions out to a few of the team leads as well, because we're having a providers meeting next week regarding this, but ways that we can alleviate some of the problems that we run into when we have a certain amount of our staff members that are off ill. And again, this is going to happen and work well when we have strong partnerships amongst ourselves and helping each other in this regard as well. So planning for staff shortages, what are we going to do and how are we going to handle it as part of the outbreak response as well. Next page. Ensuring all staff are educated and trained on the correct way to don and doff PPE. So we're walking into somewhere where something's brewing and something's going on, and or hey, you know what? Mrs. Smith is now being isolated in the isolation room until the caregiver comes and gets her. We need to make sure that she's being kept well and kept comfortable. So we're going to have to send staff in there to look after her. And in cases like that, we know she's sick. We're not too sure what he or she has. So guess what we're going to do? We're going to wear PPEs to ensure that we don't infect ourselves and get ourselves sick, especially if that staff member is feeling well and there's nothing wrong with them as well. So understanding when and where to wear PPEs, understanding how to perform proper patient care risk assessment. So before I go into the isolation room, what am I doing inside there? What am I going to be doing? Am I going to be feeding her? Am I going to be performing some form of other supports where I'm going to be close proximity to her? Am I just walking in the front door and saying, "Hey, are you feeling good?" Where I really don't need to put anything on. The staff understand that to complexity, understand how to do that as well. Consider how the facility will ensure staff have easy access to PPE. So again, we've got to ensure that those PPEs are easily accessible and not under lock and key. I know under long-term care homes, it's a different beast. PPEs can't be locked because they have to be easily accessible in case the outbreak gets out of hand. We can run and get, gowns, masks, gloves, etc. So ensuring that it's easily accessible. Consider how this facility will ensure there's a sufficient supply of PPE. So ensuring that there's always a sufficient supply of PPEs and also a sufficient supply of housekeeping equipment as well. What are we using to disinfect this area? Are we using Excel? Are we using CS20? Do we have enough of it? The staff know how to use it. As housekeeping, use it properly. Things like that have to be assessed during outbreaks as well to help keep it under control or help to end the outbreak as well. Next page. So I'm just have a quick question to make this somewhat interesting because I know you guys are probably getting tired of hearing me speak. But and this is one thing I'm going to tell everyone as well. In the next coming weeks, myself, Musa, and I think even Sheikha might be coming out to all the locations. And when I come to the location, I'll be doing some in-person training on donning and doffing. So you know what? I'll be breaking it up so I won't be sitting here doing virtuals all the time. So just to break this up, here's a question. Hand hygiene, the single most effective way to prevent the spread and transmission of germs. And it is, guys. It's one of the most important ways to prevent the spread of any infectious disease, and also helps to protect yourself as well. But good answers. Good answers. Let's move on to the next page. So again, keeping on the lines of outbreak control strategies, during an outbreak, there may be requirements for additional or enhanced environmental cleaning, which we talked about. Planning for sufficient resources devoted to environmental services to ensure effective cleaning, which we talked about. Ensure all environmental service workers receive education and training with respect to correct techniques, which we just spoke about as well. And ensure the frequency of environmental cleaning may be determined according to risk stratifications, which is it's a matrix. I'm not going to get into this per se, but you can look it up underneath PIDAC, best practices for environmental cleaning. And again, you notice how a lot of emphasis and highlight is on environmental cleaning because during outbreaks, even when I'm in an outbreak management team meeting, I go through everything. We talk about who's being isolated. We talk about who's asymptomatic, who's not asymptomatic. We talk about who's been vaccinated, who's cohorting. But at the end of the day, a lot of emphasis is put on who's housekeeping here. Okay, you're housekeeping. What are you guys doing, and how are you cleaning up the areas within here? And the good thing with us in ADP is that at the end of the day, everyone's gone. So that makes things so much easier. When everyone's gone at the end of the day, we're like, all right, guys, we're doing a good terminal clean inside here. We know that we had three people who came in ill. We have four staff members that are sick. Something is brewing. Something's going on inside here. Let's make sure we clean and disinfect this area properly today. So we'll go in there, give it a nice terminal clean. So we know that when new staff come in the following day, or new staff or even new clients come in the following day, if we're not closed, that they're protected. They're not getting it from touching inanimate surfaces. They're getting it from whoever's ill talking in each other's faces. So if you're not ill, I'm not ill, you're not ill, you're not incubating, she's not incubating, and the place is cleaned up properly, we know that we're stopping or we're halting the spread or possible spread of the infectious disease within our organization. You will see a decline in the amount of numbers and things will get better as well. Next page. Insurance class and staff, ensuring that clients and staff are vaccinated. So that's a nice one too as well. We want to ensure that those who are coming into our organization have been vaccinated. I know a lot of times you can't force someone to be vaccinated. I fully understand. I am aware of that, but it's great to know it whether or not they are vaccinated. And if they're not, to also give them a slight nudge. Hey, maybe you should go get vaccinated for influenza A. You know what? You're 75, you're 85, you're high risk. Pneumococcal vaccine, you're high risk. Influenza A, COVID, RSV, you're high risk. Just a little bit of nudge saying getting vaccinated. So ensuring that you're explaining that to them as well. Again, reinforcing hand hygiene. It's a big one. I know we've talked about it a few times already. Minimizing the spread and other risks by refraining from working at other infected agencies. So that's another big one. Whenever I do outbreak management team meetings, and this is going to apply to ADPs as well, if you're in what we call an outbreak, it's good to know who's working at other locations and tell them, hey, you know what? If I were you, just a slight suggestion, I would choose where you want to work because if you're coming here all the time and we're in outbreak and you're going into another facility that's not an outbreak and you stand the risk and your nose is running, you stand the risk of passing on whatever you have or whatever you captured or were infected with here there. Or even vice versa. Hey, you know what? If I were you, we got something going on here. Maybe wait a few incubation periods, ensure that you're not sick. And if you're not, then work at the other location that isn't closed because I don't think you should be here where we're in outbreaks right now. And again, that's all up to you. A lot of times we can't enforce that. We got bills to pay. We got people have 2, 3, 4 jobs to be able to make ends meet. Canada's expensive. So I fully understand that and I am aware of that, but it's just a loose suggestion that if you are working in other facilities, and you're in somewhere where there's an outbreak, it's a good idea to choose one or the other as well. And again, routine and daily outbreak meetings with staff. So I like to see, and what I used to do during the onset of COVID, There have been times where I've worked, again, my background's very vast. I've worked as an IPAC manager and director for a few hospitals downtown. And when I was there, whenever we have an outbreak, I ensure that myself and my colleagues that I work with, that we met at least once a day and discuss what's been going on during the outbreak, or what's been done during the outbreak, so we know that all outbreak protocols, all outbreak checklists have all been checked, and we're meeting all the requirements to ensure that we can get through this outbreak as soon as possible as well, and as quickly as possible. Next page. I'm not gonna bother going through this. I like to share it sometimes because just the outbreak checklist, and I'm just one. And the reason why I put this up here is the checklist that I had developed for us for ADP is along the lines of this, and is going to look like this as well. This is just a checklist format that I'm going to be sending out to everybody. But again, it's going to be situated like this with, reporting to public health, talking about the control measures for staff, and talking about control measures not for residents, but control measures for our clients, and what it is that we need to do. So ensuring that you promote frequent hand washing when they're there, ensuring that they're sanitizing their hands. If they need to wear gloves or masks, that they're wearing the mask, what types of masks, if they need to be isolated, that they're being isolated. It's going to be set up like this. So that's the reason why I put this out here, for us just to have an understanding that I'll be sending out a checklist like this to our sectored organizations as well. And next page. Again, all that's going to be taken care of. It's going to look just like this: surveillance, communication, environmental cleaning, whether or not you're in an influenza outbreak, and also declaring the outbreak over, which is a little different with us. We are not considered outbreak under public health, but we need to know when, okay, things are better. I think we could take off our control measures. Just have a declare the outbreak over. It's been well over 7 or 8 days or 5 days since we had any new cases that we think may have been attributed to this location or in-house. There's no outbreak. Let's just move on and declare this over, and business as usual. Next page. Role of the employer and workplace. I'm just going to touch upon this very slightly. Again, clean and disinfect surfaces that may have been touched by employees as soon as possible. Employees should not return to work until after required self-isolation period. So another one, if you're being sent home because you're sick, again, every organization has its own internal policy. The general knowledge, I guess the province has created this, is you can return after the fever has subsided for 24 hours. That's for respiratory, 48 hours for gastro. Symptoms are resolved or resolving. No new fever, again, as I said, for 24 hours for respiratory, 48 hours for gastro. If it's COVID and you come back within 5 days period, then we're asking that you wear your medical mask for another 5 days for protection. And a lot of people have asked me, Dale, what if they don't tell me it's COVID? It's influenza, it's RSV. And my answer to that has always been, I don't know how we can tell the difference between whether or not it's COVID, RSV, or influenza. So what happens, and what you've noticed, is the period of isolation or period that you're going to be home is pretty much the same thing. So if you're sick, I don't care if it's influenza, COVID, RSV, it could be anything. And you've picked something up and it's an infection, you have a bad fever, stay home. And the only time you can come back is when that fever has been stopped or has ceased for at least a minimum of 24 hours. And then symptoms are resolving, then you can talk about coming back to work. But it doesn't matter if it's RSV, influenza, or COVID. It's pretty much the same thing across the spectrum. I just had a conversation with someone the other day, and they asked me the same questions. Like, funny enough, whenever we deal with outbreaks, a lot of times we don't know what it is. We'll do a general test, MP swab, do a culture, direct EIA, the whole 9 yards, and it comes back negative. We don't know what it is, but we use the. No, I just saw something about if your clients have a cold, stay home for 10 days. No, our biggest indication is that fever. Once that fever is stopped and they no longer have a fever, they can return, and it's been over 24 hours, they can return. However, I would strongly suggest that they wear a mask just in case. A lot of times we don't know if it's a cold or whether or not it really is COVID. So that's just to answer a question that I saw pop up there just now as well. So these are things that we do to help protect ourselves. Individuals who have been identified as close contacts will be provided with isolation instructions from public health or from us as well, and use the staff screening questionnaire to determine when it's safe to return to work. So just going back to the previous thing I was talking about. So again, if you have any type of respiratory symptom, our biggest thing is the fever, because as long as you have that fever, you're still in that period of communicability. You're still shedding the virus. You still can get people sick, and especially if it's COVID, which is a super spreader and highly infectious, you will get everyone around you ill as well. So that's why we ask that if you are sick, doesn't matter what it is. You don't have to tell me it's COVID or influenza or RSV. Stay home, go get tested, figure out what it is. If you do have a fever, stay home. Don't come into work until you know for sure that you know what that fever has stopped. You're feeling better, symptoms are getting better, and you're starting to go through that stage where you're starting to resolve. Then you can come back. But again, I would highly suggest if you're in a situation where I don't know what it was that I had, then it was not a bad idea just to still wear that medical mask for a few more days or up until that day 10 before getting rid of that medical mask, just as protection as well. And that's just my humble professional opinion on that. Next, role of the employer. I am so sorry. It seems very small, but I'm going to send these slide decks to everybody as well. So the employer again is to provide supports to the staff, maintain confidentiality, work with local health department units, develop a list of employees and clients who are at risk or exposure. Um, Also provide education to the staff and to the clients about what's happening, ensuring that staff are trained in terms of outbreak protocols and what to do, and trained in their own individual responsibilities to help ensure that this outbreak is declared over soon as well, and to help keep everyone safe. And they're also there to help provide any other supports as well during the outbreak. Next page. Another question. So, symptoms of COVID, RSV, influenza are very similar, and testing is the best way to determine the difference on whether or not you're infected with either one of them. And yep, go ahead. Perfect. You guys are great. Good, 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 good. You're correct. It's true. They're so similar that, again, as I said, when I run into outbreaks, when I used to be an outbreak investigator for, not just for the province, so for public health, all the different health units I've worked for, that's always the biggest thing. I have to test you for, what do I have? I do not have a clue. I go, let me do some MP swabs, nasopharyngeal swabs. I'll get this sent out to the lab. I'll deal with the lab people on my end, and I'll let you know within the next 3 hours what we're dealing with. And that is the one of the best ways and the only way or most effective way to honestly understand exactly what we're dealing with. So again, as I said, we're an ADP, so it's a little different. We kind of have to straddle that line where we're like, hey, you know what? I'm not your physician. I'm not your medical healthcare provider. However, I would strongly suggest that because you're sick, you have a fever, I had to isolate you here in this room, that you get tested as well when you go home. Go to your GP, go to your hospital, get them to do an MP swab so you can figure out what it is that you have. And I know of lately, public health is now only taking the PCRs, from my understanding, as being the gold standard now again. So those rapid antigen tests, as much as you can still get them, and they're still a great initial indicator for whether or not you have COVID. PCR is the gold standard and is what they're looking for. So that's probably your best bet to decide what it is that you have. Next page. And infection prevention workers, health and safety. So again, general guidance is encourage employees to get vaccinated, develop strategies to minimize exposure to reportable disease, provide staff training on required public health measures, ensure staff passively screen daily with reminders. So again, ensuring staff before you come into work every day, ensure that you're feeling well. That's always my thing. I'm like, guys, before you come in, please just let me know. Do you have fever this morning? Is your nose running? Are you feeling sick? Because if you're feeling sick, it's not a bad idea to stay home. Again, I fully understand. I'm very aware of the realities of this world. Like I can't stay home, dude. I got bills to pay. I got a mortgage to pay. I fully understand. But if you are sick, it's a good idea to stay home, because it's not just you're protecting the staff, you're protecting the clients as well. And at the end of the day, if you come in ill and someone else picks up what you have, it's just hypothetically say it's COVID or even influenza, the other staff member gets it, they pass it on to your clients, they get it, they're not wearing masks, they're talking to each other's face. There's slight likelihood that you're going to be off for a few days anyways, because what's going to end up happening, depending on the organization that you work at, we're going to end up closing that program for that day, or maybe for a few days, and maybe for the week because there's so many people ill. So it's probably your best bet to probably stay home, get yourself better. And then when you're in that situation where, hey, you know what, my fever's gone, I'm feeling better. All right, let's go. Time to go back to work. And yeah, you can come back then. So again, screening yourself daily as well. Provide mask-friendly environments for those who choose to wear a mask. So that's another one. As much as we've revoked mask wearing, it's still good to wear it. If you're not feeling that you're feeling too well, which you shouldn't be at work, or if you're under the impression that someone else is ill, or if you're like, hey, I just do that as precautionary reasons because I don't know who has what. Because just because you're not sneezing or just because you don't have a fever doesn't mean you don't have an infection. Because we know with COVID, period of communicability is as far as 24 to 40 hours prior to the onset of symptoms. You're infectious. That's impossible to figure out who has. I can have it right now and be talking to my wife and my kids and not know I have it, and they be exposed to COVID and then pick it up as well. And a lot of organisms, a lot of diseases, that's how they work as well. You tend to be infectious sometimes prior to the onset of symptoms. So again, you got to wear a mask, have a mask-friendly environment for them. Schedule frequent cleaning and disinfection of high-touch services. That's a big one, as I said already. All those high-touch services in your organization, washroom handles, doorknobs, elevator buttons, you name it. Even objects that staff or clients may be using, pencils, pens. High-touch services need to be disinfected and cleaned regularly, and inform staff and clients and customers about actions you're taking to keep everyone safe. So again, communicating to everybody, hey, you know what, guys, something going on, might be an outbreak. This is what we've done so far. You know, don't feel unsafe because we are trying to make this place as safe as possible for yourself and for your clients or for your family members who are here. And plan and implement protocols to keep staff, customers, and patrons safe. All those outbreak protocols that we just spoke about on the other side, those are some of the things that we have implemented, and those help to keep them safe. So a lot of times it's good to let them know, hey, you know what? You're safe. We're allowing people to wear a mask in here. We're cleaning and disinfecting regularly. Anyone that poses a risk who is symptomatic while they're here, we're putting them in an isolation room and we're sending them home. And we're also following up with them as well with their family members and caregivers to ensure that they're feeling better before they return. We have a lot of policies in place. Everyone here is either vaccinated because that's part of our policy for our staff. So it's good sometimes to communicate that to them because it makes it looks good on you and also performs your due diligence as well. And clients like to see that as well. And I think that's it. Next page. And finally, screening. Again, as I said, passive active screening is very important. If you are coming to work and you know you're not feeling good, it's good to stay home. So ensure staff understand the importance on how to passively screen, signs to be posted during outbreaks as reminders, supplies for staff and visitors are readily available and accessible. Train staff on how to identify signs and symptoms, which our staff know, hey, she's sneezing. She doesn't look good. She looks lethargic. Her eyes are running, nose is running, coryza, whatever it is. Something's going on. I think we need to put you in isolation room and call a family member to come pick you up. Frequent reorientations, reminders to clients, hand hygiene, PPEs use, and cleaning/disinfecting. Rapid antigen screening if directed by public health or internal policies during the initial outbreak investigation. So we know right now, and I am looking for that for all of our organizations, rapid antigen tests. They used to be provided by the province, but from my understanding, it's no longer being provided. However, there are organizations that, hey, you know what, Dale, I still like using it. I won't tell you no. It's still not a bad idea to use it as part of your screening protocol if you're running into a situation where you have an outbreak. I've had a few organizations during the summertime who have had outbreaks say, hey, Dale, you know what? I'm testing anybody that comes in here and I'm picking up people who've tested positive, and I realized that rapid antigen test has been working because I no longer have positive clients or staff in my facility because I'm stopping them at the door. It does work. So I am looking at solidifying a private place where we can get that from as well. I'm working on it, but it's still not a bad thing to incorporate as well as part of your active or passive screening for staff during outbreaks or for residents during outbreaks, not residents, but clients during outbreaks as well. And I think next page. And that is it. Again, as I mentioned to everybody, I have a checklist that I had put together, which will make things a lot easier. I will get it out to everybody next week. I will send, Musta is going to send this slide deck to everybody as well who attended today. You have share it if you want to. I have no problems with that. That's fine with me. And again, if you have any questions, if you have a situation where you think you're in outbreak, by all means, feel free to give me a shout, give me a call. I've been dealing with this all summer because this summer was pretty hectic. Give me a call. I'll help you out, and I'll get that checklist out to you as soon as possible as well. Thank you, everyone, for being here today. And do you have any questions or any questions at all for me? By all means, shoot.